When it comes to health care, you want a comprehensive plan. You also deserve compassionate care, and Trinity Health Plan of Michigan delivers both. And the plan, your doctors, and Medicare insurance, they work together to deliver the best care possible. Michael Worth from Trinity Health joins us this morning with more info on those starting or currently using Medicare. It's kind of a Medicare 101. Welcome to the Morning Mix, Michael.
Thank you very much. Pleasure to be here.
Absolutely glad you're here. So let's start with the basics. Who is eligible for Medicare? Who can get it?
So primarily you're going to be talking about people who have attained the age of 65. In addition, there's a few other people who may qualify, someone who might have a chronic illness or people who have received disability Social Security for 24 consecutive months.
Okay, so there are different ways to get to Medicare. And like many people, I went and looked at those plans. There are a lot of options.
There are a ton of options available.
Holy cow.
Yes. So one of the things I always like to say is, which path do you want to go down? Because within each path, there are different options from the different carriers as well. So original Medicare is what people mostly hear about when they hear of Medicare, and that's Parts A and B. This is where you start to hear about the alphabet soup of Medicare. So Parts A and B is what constitutes original Medicare. Well, there are some gaps in those coverages. So Path A is just original Medicare. Path B is you could look at something like a Medicare supplement or a Medigap plan, and those are going to bridge the gap of the cost of original Medicare. Now, original Medicare nor the Medigap plans have prescription drug coverage.
Oh.
So you'll want to make sure that you are getting a prescription drug plan along with those, unless you receive prescription drug coverage through a union benefit or VA benefit, something like that.
It seems like there's a lot of moving parts.
There sure are, and there's even another one as well too, which is where we focus on, is Medicare Advantage. Medicare Advantage is a combination of Parts A and B, but not only is it a combination of those two, sometimes they can offer benefits outside original Medicare that aren't even covered, so it's an extra benefit to you to look at, but also as well too, many of them have prescription drug benefits included in those plans.
Okay, so these Medicare Advantage plans sound like it seems like they're taking the best of A and B and including the prescription. Sounds like the plan people want to look at.
Well, honestly, you should look at all the options available to you, because every person is unique and different, and their needs might be different than someone else's. So really, having that conversation with a professional is really going to help guide you in the right direction, which would be best for you, and ultimately what's going to be the most comfortable for you as well too.
Well, when it comes to this, though, the Trinity Health Plan of Michigan, is there a certain time of the year that we can or can't enroll for that? I mean, when do people do this?
So the main one that people always hear about, you see all the advertisements near the end of the year,
right.
So that is October 15th through December 7th. That is what we call the open enrollment period.
Okay.
The other time frames in which somebody could enroll is when someone is turning age 65, so they have what's called a 7-month window. So they have 3 months before their birth month, the month of their birth month, and 3 months after to enroll in that time frame.
Oh.
There are also what's called special enrollment periods, which are throughout different times of the year. There are different qualifiers that could get somebody into Medicare at those time frames.
So we're all familiar with that end of the year push, but
Yes.
there are separate times throughout the year and different circumstances. I didn't know that 7-month rule. That's some new information for me.
Yes.
When it comes time to doing this, what's the first step?
Well, ultimately, what you can do is I would recommend reaching out to a professional first and foremost. So you can always reach out to one of the carrier plans. So someone like us at Trinity Health Plan of Michigan, you can call us. We have licensed agents on the phone ready to help answer any questions that you may have. You can also do something like calling Medicare directly. So 1-800-MEDICARE is available. You could go to Medicare.gov, and a lot of information is available there. There are also many professionals in the field that are what we call independent brokers. They help, and they can actually get licensed and contracted with almost all the different carriers that are available, and actually be able to explain the different processes and also the different plans available to you.
Yeah, that explanation, I think, is something that most everybody really appreciates, if not needs, because of all the different options that are out there. So
Absolutely.
Trinity Health Plan of Michigan, I call you guys, and so am I talking to someone like you?
So we do have licensed field reps. We have telephonic reps. We are all licensed to be able to go over all the information that Medicare has to offer.
Absolutely. Yeah. So if you have questions, well, Trinity Health Plan of Michigan has the answers and probably has what you need for that health coverage that you need. THPMedicare.org/Michigan. That's Trinity Health Plan. THPMedicare.org/Michigan for more information, or there's a toll-free number on your screen, 1-800-964-4525. Thank you so much for the time this morning.
Thank you so much.
Absolutely. We'll be right back.